So welcome to Module 5 of the Overcoming Anxiety course, and in this module we'll be discussing CBT. So CBT stands for Cognitive Behavioural Therapy, and it's a concept that was founded in the 1960s and focuses on the theory that thoughts influence behaviours, which then reaffirm those thoughts. By understanding your own maladaptive thinking patterns, you can see how it affects your feelings and actions. It's a form of therapy that is supposed to help overcome anxiety and depression in a relatively short space of time. A person would usually have one session a week for about 6 weeks, and these sessions explore the struggles of the patient, the behaviours they exhibit when they're struggling with certain thoughts, and how the patient can apply different behaviours to override the negative thoughts. CBT explores certain thinking patterns that may influence the way a person behaves. By changing those thoughts, the undesirable behaviours should go away. It also concentrates on the fact that the behaviours are learned, meaning they can be unlearned. Many people find this form of therapy useful as it's practical and it addresses the problems immediately. The goals and the homework set by the therapist motivates the patient to do them, as they'll have to report back in the following session. However, there are also a number of cases where it has no real impact on improving people's anxiety disorders. So how can it help? CBT helps people who struggle with anxiety as it tackles the thoughts and behaviours simultaneously. Anxiety usually starts with a thought, whether it's conscious or subconscious. If it is subconscious, CBT can help uncover exactly what that anxious thought is. Once that has been achieved, the thoughts can be corrected consciously as well as influencing behaviours. CBT provides people with the tools they need in everyday life to overcome anxiety and tackle it anytime they are in a challenging situation. The more a person practices those tools, the more naturally they come. For example, if you notice a bad thinking pattern that causes anxiety, you will learn how to counteract it, which should cause the anxiety to subside. The cognitive side helps people overcome difficulties by identifying the dysfunctional thinking patterns and changing them, as well as the emotional responses a person may have to the negative thinking patterns. The therapist helps the patient develop the skills needed to challenge and change unhelpful beliefs and identify those distorted thinking patterns. The behavioural side focuses on reinforcing desired behaviours and eliminating undesired ones. It centres on challenging the beliefs by acting out a certain scenario to prove that there is no harm that comes from it. This then aims to override those past beliefs and behaviours, allowing you the freedom to create new, more positive ones. So some bad thinking patterns. CBT explores the concept of thinking errors thoroughly. Anxiety comes from worry, and certain negative thinking patterns will bring about worry, which results in feeling anxious. By recognising them, you can correct them. So here we'll list a few and explain what they are. You have catastrophising, when you take a minor event and blow it out of proportion. It leads a person to envision all kinds of terrible outcomes from that event. You have all or nothing thinking. So when you think a situation is entirely good or entirely bad, leaving no room for compromise or grey areas. Making demands is when you expect yourself, others, or the world to conform to your set of rules and ideals, and you expect them to follow it. You have fortune telling, which is when you make predictions about the future and you firmly believe that you are right regarding what will happen. And they're often negative predictions. And you have mind reading, which is when you assume you know what others are thinking, but with judgments towards you. You have emotional reasoning, when you decide that your strong emotional reaction is a true and accurate reflection of a situation. Overgeneralizing, when you make widespread judgments about others or yourself based on one thing or a small part of something. Labeling or rating is when you assign a nasty name or label to yourself or others after experiencing intense emotions and then keeping that label in place with no room for change. Mental filtering, when you only accept information from a situation or a person that proves that your thoughts or feelings are correct. Anything that disproves those thoughts or feelings is disregarded. Personalizing, when you take a random event and turn it into a personal issue, even if it has nothing to do with you or your life. Often, we all experience at least one of the above thinking errors at some point in our lives. The risk with those thinking patterns is that they bring about a lot of anxiety. The anxiety stems from worrisome thoughts about things going wrong, people judging you, or being less capable than you feel you should be. When negative thinking starts, it can be difficult to break out of it. CBT helps that problem. CBT brings attention to the thinking errors and enables you to explore fully your thought processes regarding a certain situation. Following from that, CBT then challenges those thoughts and enables you to counteract them with a more realistic and positive way of thinking. So, breaking the cycle. Cognitive behavioural therapy helps to break the cycle of negative thinking patterns, which will help you modify the negative behaviours and lower the anxiety. The cycle of anxiety usually starts with a thinking error about a situation. That thinking error floods your mind with worry and stress, which leads to feeling anxious. In order to break the cycle, you need to challenge the negative thinking patterns. So here we'll outline some ways in which you can do this. Catastrophizing. Try writing down the way you view the event and the outcomes that you're focusing on. In order to challenge this, write down what you believe would realistically happen. Also think of a time you've been in a similar situation and describe what actually happened and what was the outcome. It's important that when challenging this thinking error that you only focus on the facts, not your perception because of your feelings. If it felt like the walls are closing in, ask yourself, were the walls actually closing in? You may have felt like if something happened, it would result in the loss of your job, but is that what the actual outcome was? This may be frustrating to begin with, but with time you'll find it reassuring, as it means that things won't necessarily be as bad as you may initially think. All or nothing thinking. When facing a situation that you may view as entirely good or bad, it would be good to make a comparative list of positive and negative things about an event. Although that may be challenging initially, set yourself a goal of at least 3 things for each side. This exercise will force you to look at various aspects of one situation rather than viewing it as entirely good or bad. There are always lessons to be learned throughout life, and although we may feel sad after an event, we can learn to see what positives it may have brought about. When we view something as entirely bad, we can be afraid of it happening again, which will bring about a lot of anxiety. But by learning to view different sides of the same story, an event can cause you less worry. Making demands. By creating your own set of rules and standards that you feel are correct, you create boundaries for your life. You may become upset or anxious when things don't go as you think they should. A fact of life is that it's unpredictable and every person is unique. Write down what ideals you feel you have or rules about life that you apply to yourself or to others. Then write down how these can bring negative implications to your life when not adhered to. The final stage would be to write down a reason that each rule may be broken by others or by yourself. And then write down what would realistically happen to you or to the world if someone did not follow that rule. You will likely find that those demands bring nothing but stress to your life, and anxiety follows from stress. It's important to have your standards as they make up a part of your character, but it's also important to accept that others may not fit into that standard, and that's okay. If people are impacting your life negatively, then maybe they should not be a part of it. It's important also not to put unrealistic pressures on yourself. You are allowed to make mistakes, and you can turn them into a positive experience that you learn from. Fortune telling. Making predictions about the future rarely ends positively. They can lead to disappointment if things don't go as well as you thought, or they can bring anxiety beforehand. In an ideal world, you will let things fall into place. There is no problem with planning, but avoid predicting what you think will happen. All you can do is your best at any given time. When you find yourself fortune telling, divert your thoughts to the facts of the situation. Mind reading. Similarly to fortune telling, this often doesn't end well. It's important to realise that you have no way of knowing what somebody else is thinking. Make sure to focus on the facts of the situation. Often people with anxiety become more perceptive of other people's facial cues, meaning that you may be right about what they're thinking. However, it's worth reminding yourself of the outcomes if they are thinking what you think they are. Will it have a negative impact on your life? Does their opinion matter to you? Everyone wants people to think positively of them, but there will always be people who don't. Emotional reasoning. It's very easy to let emotional reactions cloud our judgment. If there is a situation that you had a heightened emotional response to, take a look back at it and write down the facts about that situation. Compare those facts to how you viewed the situation. If the descriptions differ dramatically, then it indicates that emotional reasoning was your thought process at the time. In future, if you feel emotion may be clouding your judgment, try to focus on the facts. Overgeneralizing. This can make life seem overwhelming and lead to a lot of anxiety. If we view all people the same, it can make us avoid social situations, or it can lead us to feeling very trapped and isolated. Write down 3 times that you have overgeneralized people. For each of those, find 3 times that someone has disproved that generalization. We are all unique, so it's incredibly unlikely that everyone can fit under one label. That brings us on to labeling and rating. Labeling or rating others or yourself only leads to negative feelings. It can lead to a feeling of inadequacy, jealousy, and anxiety. Instead of comparing yourself to others, write a list of 10 qualities about yourself. Anytime that you feel tempted to rate someone else or give them a label, remind yourself of who you are and your positive traits. We are all designed to be good at different things, so comparing ourselves to others is nothing but a waste of time. You can't compare a lion and a tornado. Mental filtering. This is a form of negative thinking that is incredibly easy to sink into. We feel as though a situation affects us in a certain way, and we try our best to prove it, not only to others, but to ourselves. Often it's subconscious, and this is where facts come in once again. For any situations that you feel only has evidence to support your thoughts on it, look for evidence that challenges it. There is good and bad to every situation. We just have to try harder sometimes to find it. Personalizing. We are the star of our own lives, so it can be easy to think that everything revolves around us or involves us one way or another. This may appear self-absorbed, but that doesn't have to be the case. It can be through feeling guilty or unworthy. When presented with a situation that feels like your fault, write down exactly why you think it is your fault. If there's no concrete evidence, then you may be struggling with personalizing as your thinking error. There will be times when things revolve around you, but not everything will be. Each thinking error takes time to recognize and challenge, but ways of thinking can be used as a weapon against anxiety. Often, positive affirmations can help us on a daily basis, and it may be worth listening to positive affirmations before going to bed. Altering the way you think will help you on a journey to overcoming anxiety. Assessing situations. Cognitive behavioural therapy offers the tools you need to be able to assess and analyse situations by looking at the facts surrounding it. By looking into past events, you can understand in greater detail how you felt about the situation, but also what actually happened and led you to feeling a certain way. This means that in future situations, you'll be equipped to assess the possible outcomes and the probable outcomes. Although avoidance isn't good, it's also important to assess whether or not challenging yourself is worth it in regards to your end goal. There will be a number of situations that you need to overcome in order to achieve your overall main goal, but there will also be some that don't add a lot into your life. For example, you may feel incredibly anxious in cinemas. This would be something that you could apply exposure therapy to so that you become less anxious in a cinema over time. However, if you don't like cinemas anyway, there may be no point in focusing your energy on that now. Instead, look for places or events that will help you work toward your end goal, which could be something like not feeling anxious on a plane. Probability of bad events. One of the tools that CBT offers is being able to view the facts and correct thinking errors such as fortune telling. Often when we feel anxious, we tend to focus on all of the potential bad things that can happen. It's understandable that we do that, as anxiety is designed to help us survive, so it makes us more aware of all the possible dangers and outcomes so that we can prepare to fight it or run away from it. CBT focuses on facts, so it's important to view the probability of bad events when feeling anxious. Think about the worst case scenario of an event, and then think of the probability of it happening based on the facts of the present situation or on the outcomes of previous similar events. By realising the probability of the worst case scenario happening is relatively low, it should help the anxiety lessen over time. Couple this with exposure therapy, which will continue to reaffirm that the worst case doesn't happen, the anxiety about a specific situation should slowly decrease. There may be times when the worst case scenario does happen, and it's good to be prepared for it. In those instances, you can also reassure yourself by focusing on the after effects of that worst case scenario. It's impossible for anybody to tell you what will or won't happen in the future with full confidence, but by understanding probabilities, possible outcomes, and facts, we become equipped to tackle the future, whatever it may bring. Putting things into perspective. When we feel anxious, we become overwhelmed quickly and things can seem much bigger than they actually are. A common example is school. When we're in school, it encompasses the majority of our life. Our friendship circles are important, popularity, looks, etc. play a huge role in our lives, and we constantly worry about our results as we are conditioned to believe that those results dictate the future we will have. Once we leave school and finish education, though, we see that those things weren't actually that important. It's similar with anxiety. People who suffer from anxiety disorders usually have a fear of embarrassment, for example, fainting in public. Often this type of fear results in people staying inside the house and they cannot live their life as they'd like to. Think of a fear that may be stopping you. What are you worried about when you feel anxious? After you write that down, analyse the likely outcome following that fear coming true. If we use fainting as an example, it's likely that someone would call an ambulance and then a paramedic would check you over to make sure you're alright. Maybe the fear of fainting would be a fear of banging your head. If we look at the facts, when people collapse there is usually some kind of warning beforehand, in which case you would be able to sit down, even on the floor if necessary. It would also be good to make sure that someone is with you, so then if you were to lose consciousness, you would be with somebody you trust. Although that type of event may seem traumatic, it may not be the outcome. It's important to view the potential benefits of putting yourself in that situation regardless of the outcome. By putting things into perspective, you can reduce the stress you feel, which should help in reducing anxiety about certain things. It will also hopefully encourage you to live a life that you enjoy rather than being confined to a certain area you feel the bad event cannot affect you. It will also hopefully encourage you to live a life that you enjoy rather than being confined to a certain area you feel the bad event can't affect you. Exposure plan. The biggest part of CBT is an exposure plan. The thought behind it is that when you're exposed to the event or situation that you get anxious in, your brain will register that nothing bad actually happens, and the more times you do that, the less anxious you will feel. When developing your exposure plan, it's a good idea to go back to your trigger list and work around those. Set yourself challenges to go to them with someone to support you. Do not concern yourself with time frames, as that will add further stress when you feel like you're struggling. You will have completed the challenge when you can go into the situation and only feel a low-level anxiety. Planning out which situations you put yourself in first means that you can monitor your progress and not overwhelm yourself with challenges too big for the time being. Safety behaviours. When people suffer with anxiety disorders, they often develop safety behaviours. These are behaviours that we believe help to reduce the anxiety experienced. A common one with social anxiety is escaping the situation. They can be simple, such as needing something to fidget with or having a specific drink or item with you, or it could be something more complex. Leaving a situation often does reduce the anxiety, as we've left the place our brain sees as a threat. The only problem with that is your brain confirms to itself that that place was dangerous, and now you're out of it, you feel better. Although safety behaviours may look like they're helping, they can have a negative impact to your journey in overcoming anxiety. The concept with this is that they keep the notion that there is a danger when you feel anxious, as you need to do something specific to keep you safe. In CBT, it's recommended that you identify certain behaviours that you are implementing and then refrain from using them. Once you feel anxious and do not use a safety behaviour, you can analyse the difference as opposed to when you do use one. You can look into your feelings, but once again, it's important to look into the facts. Once you realise that the safety behaviours are not literally keeping you safe, the anxiety should subside. So in conclusion, CBT can offer many tools that help in the daily challenges when overcoming anxiety. It helps us understand where the anxiety stems from and then shows us ways that we can change our thinking patterns to hopefully reduce the anxiety. There are a number of positives to this type of therapy, and many people find that it helps. However, there are instances where it doesn't. Similarly with counselling, it depends on the therapist you have to guide you. There needs to be a connection and understanding between the counsellor and the patient in order to see successful results. It's also crucial that the plan developed is tailored to the patient's needs. CBT cannot be successful if it's tackling a thinking pattern that is not causing the anxiety. Thank you for listening, and join us next time for Module 6, which is the final module.